Hello, and thank you for joining me again on Ask Kate, brought to you by the Children's Tumor Foundation, a weekly session with me, Kate, where I'm answering questions from the NF community. Today I want to talk a little bit more about clinics and when you go and see your doctor. We're going to approach it from a little different angle today. Instead of talking just about the NF Clinic Network, I want to talk about really two main things. The first is what you might consider when you're looking for a new doctor. The second being, how do you get ready for that really big appointment? Maybe you've been waiting a long time and a lot of pressure is on it, and how do you make sure that you're walking in as prepared as possible? So, to begin, let's talk a little bit about choosing a physician. Now, for some patients, you're going to be limited on where you can be seen by your geography, the kind of insurance you have, and that's okay. We are here to try to help. So if you are living somewhere that is a little remote or not even remote, but you just don't know where to be seen or who does NF in your area, you can always contact me. My information is right down there, like I say almost every week, and you can contact me. I am so happy to try to help you figure out where you can go to talk to a doctor who's going to understand what it's like to live with NF and how to help you. The other things to consider, though, perhaps you do have some options. Perhaps you've been given some names by others in the NF community, or you've gone to our website and seen that there's more than one hospital or provider within a driving distance for you, and you're not sure kind of how to proceed from there. So a couple of things to think about. First, you might think about the specialists and types of care that are available at a particular clinic. So if you need a great orthopedist, you're going to want to look for that. Not every single NF clinic necessarily has an orthopedist as a part of their group who understands or has a lot of experience with NF. So you want to consider who's working in that clinic, what does their multidisciplinary team look like, and what kind of care are they able to offer. The next thing you would think about is the type of patients they see. So our NF clinics in the network will see NF1, NF2, and schwannomatosis patients. But given that NF2 and schwannomatosis can be more rare and often affect adults or young adults more than children, these are things you want to think about when you're going into a clinic. What kind of experience does this clinic have seeing various types of NF? And of course, ages. Some of our clinics only see children, so you need to consider that ahead of time. You can think through what the physician's experience and expertise in NF might be. That's information that can be difficult to get. You're not really going to always know ahead of time how much this particular doctor knows about NF, or at least perhaps how long they've been working with patients with NF. You can ask around if you're connected to your NF community and see what people are saying about a particular clinic or center. So that's something that you can consider. A few other things would be the number of patients they see every year, their involvement with CTF and the NF Clinic Network, and opportunities that they might be able to offer in participating in research. Those are questions that you could ask if you call the clinic to talk about an appointment. You can also think again about insurance coverage and any out-of-pocket costs that might come up if your doctor or institution that you want to see is not part of your insurance network. And the last thing I want to mention that I think is important is to consider referral by the NF community. So people living with NF in your area may recommend a certain doctor or clinic because of a really positive experience that they've had. And here at CTF, we love to hear those stories. So if you've got a great NF doctor that isn't connected to us, we would love to hear about that so that we can build relationships with providers all over the country who might not know about us and the work that we're doing. So moving on, I want to talk a little bit about what it looks like to be prepared for your visit. So like I mentioned, it can be very frustrating to go into an appointment that you've been waiting for and that you've been excited for or nervous about and walk out feeling like you didn't ask all your questions or you didn't understand information you were given or you felt rushed or not heard. And so I think there are a few things that you as the patient can do to really empower yourself to have the best possible experience. So the first thing is that you can organize your own medical history. So some people will do this in a binder, some people will do this digitally. Maybe it's a file they have on their computer or their smartphone or tablet. And this should include things like a list of any doctors that you've seen, of course your diagnosis, any personal records you keep, perhaps a headache diary or a history of your pain symptoms. You're going to want to include, of course, medical records. So lab test results, genetic test results, any scans like an MRI or a CT scan that you've had done. Really any medical related documents would be important to include. And of course, a complete and current list of any medications that you're taking. That includes over-the-counter medicines as well as vitamins and natural supplements. So if you can include all of these things in one centralized location, that can often be really helpful, particularly if you're a new patient to a doctor, where he can quickly see sort of what your medical history has been like. The next thing is that when you walk into an appointment, it is so important that ahead of time you make a list of any questions that you have and prioritize your concerns. Now, this is important even as a returning patient, because often if your doctor saw you 6 months ago and your major concern at that time was headaches, he might ask about that first. That might be the first thing that he or she will want to talk to you about. Well, maybe you've had some relief from headaches and you have a new concern, something else that's been bothering you or been difficult. So make sure that you just ahead of time write down, what are those questions, what are those main issues that I really want to make sure I get to talk about today. You'll also, of course, ahead of time want to confirm time, location, and any parking issues for your clinic visit. I worked in a big NF clinic in Los Angeles for a lot of years, and I can't tell you how many patients were really late for appointments because they just didn't realize how difficult getting around the city and navigating parking was going to turn out to be. So any information like that, if you can get it ahead of time and be prepared, you can walk into that appointment feeling calm and ready instead of distracted and frustrated by the experience of getting there. Also, important is if you need any kind of an interpreter for sign language, or you speak, if English is not your native language, most large facilities are going to be able to offer those services, so be sure to ask ahead of time. Next, we'll talk a little bit about what you might bring to a visit. Most clinics or physicians are going to give you that information, but we wanted to provide it as well, just as a reference. So you might want to think about, of course, the basics. You're going to need a photo ID, medical and pharmacy insurance cards, referral authorization, if that's an issue, form of payment for any services that won't be covered by your insurance that day, and preferred pharmacy name and phone number in case any prescriptions are given. Also, for parents, if you decide to send your child to an appointment with someone who is not their legal guardian, you're going to need to send custody or consent papers that allows that adult to be at that appointment with your child. And you can ask the clinic, if you're in that situation where you need to send your child with grandma or an auntie, ask the clinic ahead of time what they're going to need to make sure that that visit can still happen. Of course, any required paperwork from the clinic, medical history that we talked about, maybe that binder you're creating or some kind of digital record of your personal history. We talked about your list of questions and concerns. Also, a notebook for writing down the information that you're given, the names for referrals, phone numbers, anything like that can be really helpful. And lastly, I always recommend considering bringing a family member or trusted friend. A companion can really help remind you of maybe the important things that you wanted to talk about. They can help you ask questions, and they can take notes for you so that you can be more focused on your visit. During a visit, I suggest that you just make sure that all your questions are answered and that you understand the information. You know, physicians and doctors and nurse practitioners, and they're human. And sometimes they've got a lot of patients to see, and they might give the impression that they're hurrying and rushing, but it is absolutely important that you understand any information that you're given. So just keep asking questions until you feel confident that you can understand what you've been told, and they will be able to answer those questions for you. Request a visit summary, which is often like a brief note from the doctor that will include follow-up instructions. So that will be if they made a referral or if they wanted you to get certain lab tests done, that information should be printed and ready for you. And also make sure you find out who to call for questions. A lot of times we had patients coming into our clinic who they would leave and then realize that, oh, I went and had labs done after that visit, but I don't know if you're calling me with those results or I'm calling you, and that can be really frustrating and confusing. So be sure to ask, who do I call if I get home and realize I have a question, or I want to know how those test results came out, what's the procedure? That's a great question to ask. So I hope that this has been helpful today, just a few tips and tricks for how to make the most of any visit with any physician. As always, if you have questions about this or concerns, or you've had an experience that you want to share, feel free to comment down below. We love to see that you're participating and active. Email me, call me. I love hearing from the community, and I hope everybody has a great week. Thanks so much. See you next time.